Good morning, everyone. It's so good to be here and look at something that is topical because not only locally but globally, various health departments and nations are turning their attention to mental health and mental illnesses. I am Dr. Jubilee Brown Service, and I'll be doing this presentation today on bipolar disorder and the church. So we want to look at what is bipolar disorder. Right, what is bipolar disorder? It's characterized by extremes, extreme high or extreme low. And the highs are what we term mania, and the lows are what we term depression. So it's just this very high feeling of happiness. Very often it's not triggered by any particular event that's happening, any positive event that's happening, and extreme lows. I mean, these things, this low is debilitating. This low will cause you to be in your bed for days, not doing anything at all, not participating in your usual function. And that is why it's such an important thing to look at. Now with mania, just to look very quickly at the symptoms of mania that we often look for as mental health practitioners. So it starts out with the person having an abnormally, persistently, so it's abnormal, it's persistent, elevated mood, and that's the high that we spoke about before, or they're very irritable. So everything tick them off, everything trigger them. There's no patience, there's no understanding. And it's associated with 3 or more of the following symptoms. All right, grandiosity. And grandiosity can occur on a spectrum, really, from just you feeling too good about yourself, thinking of yourself a little more highly than you should, and to the point where you now have thoughts that you are superior. Very often people feel that they're God or they have some supernatural powers. That's grandiosity. A decreased need for sleep. So you are not sleeping enough hours. And the average adult, when I say adult, person older than 24, the average adult needs about a minimum of 7 hours of sleep. You know, give or take an hour or 2, but generally speaking, 7 hours of sleep. But you'll find that persons who are in mania, they will be sleeping for 3 hours per night and they don't feel tired. They feel energized as if they have slept adequately. And so that is one of the symptoms we look for. Talking excessively, and that's self-explanatory, racing thoughts. They cannot keep on one topic. And often when you're interviewing a manic patient, in 2 minutes, the patient has run through 50 topics, 100 topics, because their mind is unable to stay on stream with the conversation. They're easily distracted. And we're talking about being distracted by things that are not important. So they'll be talking with you and somebody unrelated to the discussion might say something and instantly their attention is directed to that conversation that they're not a part of. And that's just an example. Increased physical activity. And to elaborate on this, increased physical activity is 1, increased purposeless movement. So they're just pacing back and forth, probably walking in and out of the house, walking up and down the street, or they now embark upon multiple projects. So they're going to start a project at work, start a project at home, taking new initiatives all over the place. And very often you find that there's no cohesion in what they're doing. And to the outsider, you realize, but this is not a normal way of going about these various activities. I remember I had a patient, and when she became manic, when she had her manic episode, she repainted her entire house, started to go on this extended fast, went to the church and started doing a lot of activities in her church. Like I think she called some baptism candidates and was doing sessions with them. So all of that was taking place over the course of 1 to 2 days. And her family realized that, no, she's getting sick again. Poor decision making. And this poor decision making is where there's a lot at risk. So you'll find patients who are manic, they're spending off their money, spending off their savings, going into bad business investments. They have a lot of sexual indiscretion. So often in the manic episode, you find that there's a heightened sexual drive. And this sexual drive is not is not just an increased desire for their partner, but they're not exercising discretion. So they're probably having unprotected sex with people they don't know, multiple partners. They'll see people on the road and make inappropriate sexual comments to the persons on the road. And it's also excessive, all right? For depression, so we spoke about the first part of the bipolar disorder, which is the mania, or one aspect of bipolar disorder. The other aspect is depression. And interestingly, a lot of people who are diagnosed with bipolar disorder, you will find that over the course of their disease, they're actually primarily depressed. The manic episode is not even the predominant manifestation. And I want to take the time here to really encourage people. You may not think that you're manic, but if you feel that you are depressed, you're having a depressed mood most of the day, nearly every day, you're losing interest in things that you usually had an interest in. So maybe you previously liked watching TV and all of a sudden you don't like to watch TV. You don't like to do your gardening. You don't like to cook. These two symptoms here, we should be looking out for. These are basic screening questions for depression that you can ask yourself. And if you answer yes to any of these two, I do encourage you to seek mental health intervention. Other symptoms of depression: weight loss that is not explained by you dieting or changing your diet, or a decrease in your appetite or an increase in your appetite. And we're talking about a stark increase or decrease in your appetite, all right? Restlessness, again, you're unable to sit still, you're moving up and down, going all over the place. Or in depression, you can find that the person becomes very slowed down. Very often patients will describe it as feeling like they're frozen, like they're stuck in one place. They see something they want to do, they know they have the energy to do it, but they just don't have the motivation to get up and go and get it done. All right. Loss of energy. So you're getting tired easily. You know you have eaten, you know there's nothing physically, and when I say physically, meaning there's nothing wrong with your chemical balance, you're eating well and stuff, but for some reason, you just don't have enough energy to do what you need to do. Feelings of worthlessness, that you don't have any value, that you're not loved, or guilt, blaming yourself for things that have passed, sometimes blaming yourself inappropriately as well. I have had patients who will blame themselves for somebody's death. And when you probe it, they really could not have prevented the death, but they still take on that burden of guilt. Difficulty concentrating. You have a task to do and you cannot stay on task because you're so depressed. And this one, thinking about death or suicide very often. These are symptoms of depression. And typically we diagnose depression or a depressive episode if you have been having these symptoms for about 2 or more weeks, all right? And right, so as I said, you know, we know when people think of bipolar, they just instantly think about the highs, but the lows, the depression is a very serious and important component of bipolar disorders. Very briefly, you have a number of bipolar disorders that we make reference to. You have bipolar 1 disorder, bipolar 2 disorder, and truly the only difference between the two is the duration of the symptoms. So for bipolar 1 disorder, it is where you have been having symptoms for the greater part of 7 days or more. And for bipolar 2 disorders, where you're having the manic symptoms for 4 consecutive days, right? And you have a number of subtypes of bipolar disorder, which is really a varying combination of timeline and symptoms that we're not going to delve into today. Now, one can, if the patient is having a very intense episode of mania or depression, they can have abnormal beliefs, which we call delusions. And I alluded to some of them earlier. They start to think, in mania, they start to think that they're God. I've had patients tell me they're God. I've had patients tell me that they can heal everybody from corona. I've had patients that tell me they can read people's thoughts and they can just look at them and heal them. These are abnormal beliefs and they're what we call delusions. You can also have what we call abnormal perception of their environment. So things are happening around them, but they're not taking it in. They're not taking in the information and processing it in a normal way. So for example, They see an image and they process that image as being very real, even though the likelihood of it being real is low. And these are what we call hallucinations. So you're seeing this image, or you're hearing voices, you're in a room by yourself, you're hearing voices, you know that there's no source of it, but you're hearing people talking. These two can occur in the context of bipolar disorder. And when that happens, we refer to it as psychosis, all right? And just to note that psychosis can occur in other mental illnesses as well. So some other things I want to highlight: bipolar disorder is not just mood swings. People will often come in, Lord, she bipolar, man, she's so she stays, so yesterday she put this, today she not good. But normal people will always have shifts in their emotions in response to daily circumstances. And you can actually experience more than one emotion at a time. So if you had a document that you turned in before the deadline and you're feeling proud of yourself, you know, you're feeling encouraged because you finally met a deadline, you were able to submit the document, but when you got to the front counter, the clerk is going to tell you, you have another document to submit. You're feeling happy, you're feeling glad, but you're probably also annoyed or frustrated because, you know, you wish this had been said to you earlier. So it's important to understand that our emotions can shift and we can experience more than one emotion in any given time frame. All right. So you don't just jump up and say people have bipolar disorder because they're happy today and maybe tomorrow they're not so happy. And another thing I want to state is that very often persons who are diagnosed with bipolar disorder, they can be diagnosed with other psychiatric diagnoses. It's very common that persons diagnosed with bipolar disorder have one or two other psychiatric diagnoses. For example, they could have a personality disorder, or they could have what we call a substance use disorder. It is just so you know, right? Because very often when I interview patients and at the end of the interview, you come up with a list of diagnoses, they're very surprised. You know, I come in for one thing, I know you're telling me that I have these 3 things, but it can occur, all right? What is the cause of bipolar disorder? The cause of bipolar disorder, any mental illness for that matter, let me not say any, but the ones that are not caused by medications and illnesses and drugs, meaning illicit drugs. The exact cause is really not known. We do know that for bipolar disorder, though, there is a strong genetic link. So if someone has a relative, one relative that has bipolar disorder, a parent, their risk is automatically increased. The more relatives you have in your family who have bipolar disorder, the greater the risk of you having bipolar disorder. And so the cause of bipolar disorder is multifactorial. There are various things that can happen in our biology from birth coming right up, in our environment, and psychologically. And just to go through it in a brief manner. So biologically, genetics, as I said, if you have relatives that had bipolar disorder, chances are there's an increased risk that you too can have bipolar disorder. Differences in the structure of the brain, all right? Your health, your general well-being, are you somebody that has other illnesses? There are medical conditions that can cause you to exhibit symptoms like what we described with mania or depression. Inflammation, so you're sick, you're having illnesses, various viral illness, bacterial illness, and the body is reacting to that. In the midst of that, your body can trigger depression or mania. Your environment, what is your lifestyle? Are you stressed out? Are you smoking, drinking? Have you experienced traumatic events? Maybe you had a tragic loss in your life. Maybe you were molested as a child, and that's a big one that's coming up, that the events that occur in childhood, we're seeing that a lot of adults present in their older years, and you realize that they were significantly affected by that trauma. And I'd like to take this time to say that I do know that the Ministry of Health has launched a new hotline where one can report child abuse, and the number is 211. So it's very important for us to be looking out for these things, children who are being abused, because they turn up later in life and you realize, wow, you have been traumatized. Stress, work stress, family stress, relationship stress, all of these can trigger. And as I said before, it's a multifactorial cause. We can't really pin down one thing and say, this cause it. All right, psychologically, you find that persons who start out with a low self-esteem, they're usually predisposed to having a lot of depression-like symptoms. People who were probably started out with an unrealistic view of themselves, yes, they will tend to have, they can be at an increased risk of having manic symptoms. Poor coping strategies. This is a very important one. When stress comes your way, how do you deal with it? Have you implemented the right strategies to cope with and deal with stress? Persons often think that if you don't invest in that before, when you're faced with being diagnosed with a mental illness, you find that it can be very difficult. So often I find that patients who before being diagnosed, they already had certain things in place in terms of how they dealt with life and stress and relationships. I find that they fare better because they already had the things in place, and they just take that information, translate it into their life where they're now living with a mental illness. So we spoke about bipolar disorder, and I've really just given an overview of bipolar disorder in terms of mania and depression. And it's important, the first place to start really as an individual, or if you have a relative, is to recognize that something is wrong. Very often, even with just medical conditions in Jamaica, we like to watch things, right? The foot can be rotting off and they say, no, me, I watch it. And very often it's the same thing in persons with mental illness. You'll interview a relative, you'll interview a parent, and you say, when did this start, mommy? And mommy said, why, doc? Say 3 years ago and did say X, Y, and Z, and you look at the person you're saying, so you didn't think that was abnormal. Yeah, my mom just thinks I'm bit stressed out because of whatever, and they didn't take it seriously. I know that they have progressed, they're realizing that that was the beginning of the mental illness. All right. And once you have recognized that something is wrong, seek appropriate help. Appropriate help. In the context of mental illnesses, there are three good places, one of three good places to start. You can start with a private psychiatrist. You can start with your GP, that's a general doctor, right? And they will know how to refer you appropriately, or you can go to an A&E department. If you have a relative and they're expressing thoughts of hurting themselves or hurting other people, and you believe that this is in the context of a mental illness, an A&E department is where you should be, because that's an emergency. They are a risk to themselves, and they are also a risk to others. In terms of treatment, there is no one thing that can be done. And so treatment takes into consideration all the aspects of the human being, the biological, the physical, the psychological, the spiritual. All of these have to be taken into account for anybody, well or unwell, and especially for those who have to be living with illnesses, mental illnesses. So a good place to start is to eat properly, eat well, have balanced meals so that you're getting in the right amount of vitamins, the right amount of nutrients, cut out the things like smoking, using alcohol excessively. Those can be reduced, right? Because your overall health contributes to how you feel about yourself and your mental health. In addition to that, supplements are also very good. There's no specific supplement that one can say, if you have bipolar disorder, take this supplement. But depending on your lifestyle, depending on what you know that you have to do, you may choose various supplements to meet those needs. All right. The mainstay of treatment is medication. I am yet to meet a bipolar patient that does not need medication. I'm yet to meet somebody with mania that doesn't need medication. I'm yet to meet somebody with moderate to severe depression that doesn't need medication. And what the medications do is really just balance back out the chemicals in the brain. As in mental illness, after all the various causes have come together to precipitate the mental illness or to trigger off the mental illness, then you find that the chemicals in the brain are not balanced, and we now have to balance it out. And there are a wide combination of drugs that are used in the treatment of bipolar disorder. And to say that, and I'll just say this, each patient is different. Each patient has a different makeup. So you'll find that one patient will be very, very sensitive to the medication, and you can put them on a small dose of medication. You'll find another patient is not as sensitive, and you have to be putting them on high doses or a combination of medication. So you can't say, oh, me did have a cousin and them did diagnose him with bipolar and I one pill them give him. So all them I give him 3 pills now, all them I give this other person 3 pills. You can't look at it like that because each patient is different. Psychological intervention. As I stated before, very often we find that persons who are diagnosed with mental illness, there are underlying psychological issues. Trauma being one of the biggest ones, right? And so psychological intervention is usually warranted to help you work through that trauma, to help you work through these psychological things that you have been experiencing. All right, to help you work through how you feel about yourself, how you feel about life. Foster healthy relationships. Listen, I don't know how much more I can emphasize. It's so important that as individuals, whether or not you're living with a mental illness, that you have healthy relationships in your life. Find people that have your best interest at heart. Don't push them away. Yes, we know that every relationship will have tension from time to time, but cultivate these relationships and deepen your faith. If you're a professing Christian, deepen your faith. The Bible clearly outlines the spiritual disciplines. Deepen your faith, read the word, do your private praise, your private prayer, spend time in corporate gatherings. Very important for us to have healthy social relationships, all right, and a healthy social life. And also, last but not least, in terms of engaging in constructive activities. So one of the things for us, working with persons who have a mental illness is that we encourage them once they're able to, because mental illnesses can cause deterioration in your ability to work. And it does so where physically you're not able to either do the work, so you might be so depressed that you're just not able to do what is required, or you're not able to function in a work environment because you're agitated or you're loud or you're disinhibited. But also, very often in mental illnesses or persons who are living with mental illness, there's impairment in the ability of the actual brain to function. So their cognitive function can be reduced. With bipolar disorder, it is not the greater portion of patients who have cognitive impairment, but it can occur. And so where it is that you are able to work, we encourage you work. Find a job that's not overbearing, find a job that's not going to become a trigger, and stick to it, because when your mind is engaged gainfully, we find that the patients fare better. All right, and also find constructive recreational activities to do. So whether you're going to do gardening or you're going to do a sport or whatever it is, something that helps to develop you as a person. So it's not good if you're diagnosed with a mental illness to spend half of your time in the bar drinking or smoking or sitting on the corner with your friends. I have so many patients, and particularly young males, where they come in and they know they want to stop smoking, And you say to them, look, if you know that the friends around you, if how you spend your free time is to sit down and smoke with your friends, you have to cut that out. Because we know that that is going to cause them to go back into the smoking and they're going to deteriorate. We see this every day, all the time. All right, so that's what I would say in terms of treatment. It's a holistic approach with medications being the mainstay, but really and truly, it's a holistic approach to the treatment. And I want to encourage persons who have relatives that have mental illnesses, and specifically bipolar disorder, to be understanding. So often, it's challenging. And so often it's challenging that you have to be dealing with somebody with a mental illness. It is difficult. You see the caregivers come in and they're feeling the burden of care. If you need help, get help for yourself. I've had multiple relatives that have said, look, I think you need to sit down with a psychologist. All right. And right, so that's what I was saying. So be understanding and help them to develop healthy social relationships. All right. Okay, so, right, what should be the response of the church? You know, I really appreciate and I want to thank Minister Tyrell that for embarking on this project where he's trying to put the information out there for persons to understand, particularly the church, to understand mental illnesses, to understand how we deal with it. You know, it's so important. And in doing this, in educating, so this is a part of the church's response, in educating, you help people to understand the illness, you reduce the stigma, it helps us to differentiate what's normal from abnormal. And I'll share a story very quickly. I had a patient and she was in a manic episode and she had been brought to the hospital. She had gone to a church and we're not sure what had happened at the church, but the church got police to take her in. So the first morning I'm interacting with her, she says to me, you know, can you hold my hand? No. I held her hand because I want to build a therapeutic alliance with the patient. I wouldn't want to just reject her request and, you know, break down that relationship between me and her because I need to help her get better. But I held her hand and I was very aware. And so as a Christian, I covered myself very quickly in prayer. I said, Lord. And then she tells me all kind of things. She tells me that I have asthma and all this. She's now prophesying, right? Which I've never had an asthma attack in my life. But when I came out from the situation, I realized that probably the only reason I was able to differentiate or to clearly say this is abnormal was the context within which I saw her. And some of the things that she was saying was not true. So I could easily see that patient being in a church at an altar, giving out these prophecies, and it being true for a number of people at the altar because asthma is a very common thing in Jamaica. And so, you know, I came away from that experience in realizing how important it is for the Church of God to know, to be able to discern, to be able to see what is normal from abnormal, to have people, to have persons be accountable, right? So if you have a minister in your church, they really should be accountable to somebody where that person is sitting down and engaging them on a frequent enough basis. And if anything is seen that is not normal, that this is dealt with. It's not just shrugged, pushed under the carpet, but that it's dealt with, right? So very, very important. Okay. And so on that note, I want to say I'm really, really pleased that I was able to share in this forum. And as we wrap up, I'm going to take a few questions that I'm seeing coming in. And so the first question is, are males more affected than females? No. The studies have not been able to definitively say which gender is more affected. What they have found is that more women are diagnosed, but that could be because more women tend to have a better health-seeking behavior, all right? But in terms of definitively saying men or women are more affected, we're not able to say that at this point. More women are affected by depression. And so you find that very often women who have bipolar disorder, they will present with the depression aspect of it, all right? And is there a link with the genders? Is there a link with the genders? I would ask for some clarity on that question. Is there a link with the genders? And so I'm going to ask the person to clarify that question, and then I'll come back to it. Can children be affected? Children can be affected. However, so you'll have children as young as 5 that have been diagnosed with bipolar disorder. However, because children are in that developmental stage, right? Very often it's hard to say, is this just a developmental stage that you're going through, or are these the signs of bipolar disorder? And so for me, the senior consultant in child psychiatry at UWI, she's very careful about concluding that a child has bipolar disorder, because very often they outgrow some of the things that you see, and it really was not bipolar disorder. It's really not manic episode or depression. So children can be affected. And to me, if you have a child that you know, or a child that's close to you, and you believe that there are things that are not normal with how the child is behaving, have the child see a child psychiatrist. We have a number, well, a psychiatrist, because we have child psychiatrists, but a number of general psychiatrists also see children because they're trained. Their training allows them to understand mental illnesses in children. All right. Is there a link with diet and bipolar disorder? With the studies, there is no clear link that a particular diet causes bipolar disorder. And so it comes back to where I was saying that the cause is multifactorial. So you can imagine if a person has a parent with bipolar disorder, they are not eating well, they have a very poor diet, drinking a lot of soda, whole heap of salt and sugar, then probably have a little touch of depression and diabetes, then you would understand that they're now setting up themselves to a higher risk of having that mutation, that genetic predisposition begin to manifest itself. So there's no direct link with diet and the causation of bipolar disorder. But yes, poor diet, poor lifestyle can contribute to the onset of mental illness. Because as I said, we are a tripartite being, so body, soul, and spirit. Gender question. Okay, so clarity on the gender question. In terms of the woman producing more estrogen, and it is said they're said to be more emotionally fragile. No, well, yes, we know we said that in general discussions, but when it comes to looking at the psychiatric articles, that doesn't weigh in very heavily on bipolar disorder. Remember what I said, depression, yes, women tend to have a lot more depression, but we are cognizant that men underreport. And you can imagine in a culture where men are not supposed to cry, men are not supposed to show emotions, you can understand how there would be a high level of underreporting. I've treated a lot of male patients with depression, but I have treated far more women with depression. In terms of bipolar disorder, to be honest, I can't say that I have seen far more women than men or far more men than women. I've seen quite a bit in both genders in terms of bipolar disorder. So I hope that answers the question there. Does the person have to be on medicine for the entire life cycle as is prescribed, or you're seeing total recoveries beyond prescription? Okay, so bipolar disorder is one of those what we call enduring mental illnesses. You find that when a person has had a first episode of mania, very often they have recurrent episodes of mania. Very often. To date, I am not sure if I've seen anybody who does not have to come back. So they may pause for a year or two, but they usually have to represent because that is how it is. It's enduring, and the process is a persistent process. It's not something that we can cure. We can definitely treat. All right. And yes, so I believe that's it for this segment. I again would like to thank Minister Terrell for having me. And I do hope that I was able to impart the relevant information to help us better understand bipolar disorder. Jesus,